All right, I believe that we are up and running. Good afternoon, everyone. Happy 2022. Certainly thought maybe 2022 would start a little bit differently than 2021, but here we are again. The ever dynamic and extraordinary coronavirus that continues to provide unthinkable disruptions in many, many different ways. The last time that we were together, I think was just around Thanksgiving. And I think at the time, all of us felt like we had weathered the Delta storm, that we were moving forward successfully, and that things were really headed in the right direction in every way, shape, or form. And then lo and behold, we've been struck with the new Omicron. Certainly it is unbelievably acute. And all of us have had many conversations with our hospital administrators and members from our health community who are just deeply, deeply, deeply struggling at the moment. And I want to really start by I know it's cliche almost at this point, but just thanking all of the health professionals in the state of Maryland who have weathered unbelievable storms, as so many have, but they have been on the front lines for now going on to our second year of this. And what they are doing every day is truly remarkable. And I know they are exhausted and tired, and we just are incredibly thankful for their professionalism and what they are doing every day to help the state of Maryland get through this truly extraordinary once in 100-year event. Of course, if we look at our data, we're sort of in this confluence of cognitive dissonance at times. We have some of the highest positivity rates, but also much more mild cases. And from my unscientific perspective, it seems clear that this Omicron variant has been a lot more intense. But there are the costs associated with unvaccination and with those who have not been vaccinated. And so, as this being the Vaccination Oversight Workgroup, it has never been more important, as it continues to be, to ensure that as many people as possible get their vaccinations and get their boosters. It is just so very clear how much of a difference it makes. And when we look at the hospitalization rates, it is those who have been unvaccinated or have not kept up with vaccinations that are our most acute cases and are really creating a strain on our entire system. And so we know the solution here. We understand that while folks may have had different opinions, this is where the science is pushing, and it just seems more and more obvious each day that we are safer and better off the more folks that are vaccinated. And that is most acutely the case for our young people. And so getting those 5 to 11-year-olds, I'm sure we'll hear from the secretary today, it is an absolute top priority. We have got to do whatever we can to keep kids in schools. The kids are bearing the brunt of the costs of this these days. And if we cannot keep kids in schools, the impacts go well beyond the passage of the virus. And so that continues to be the top priority, is finding ways to keep children in school. Without further ado, it looks like we have everybody with us now. I'm going to hand it over to Mr. Mike Powell, the Director of the Office of Program Evaluation and Government Accountability, who will give us an update on the recent vaccination numbers from the BLS perspective. Mr. Powell, to you.
Sure. Thank you, Mr. President. And Sally, if you could put up the first slide. This is the positivity rates. And let me move the pictures of all you guys out of the way. Hit a dip to below 3% in early November. You can see that dash line, which is, I believe, when the first person who tested positive with the Omicron variant had been tested. And then as recently as today, I believe that is over 28% positivity. Next slide, please. This has positivity this time in orange. The blue shows the number of tests. Typically, when the virus goes up or down, testing moves along with that. We're seeing that again, but I would say testing's maybe doubled in the time that the positivity rate has gone up, maybe 5x. So it is increasing, but not as much so as the positivity rate has been. Next slide. This is a map, and I'll caution about it in a second, but of new cases since November 4th. That was when the positivity rate was at its recent lowest. And yesterday, the blue zip codes are below the state average. The yellowish brown zip codes are above the state average. The larger a zip code is just the more people that live in it. My caution about this is that These are case rates, not positivity rates, and case rates are impacted by testing. So if you have a zip code where nobody gets tested, you don't have any cases, even though people may be sick. And if you have a zip code where lots of people get tested because it's a condition of work or school or whatever, you'll pick up asymptomatic cases or people who otherwise wouldn't have known that they were sick. So I do want to caution that, but I did want to include it just to give us a sense of where cases are. Next slide, please. These are case rates by age. They are highest for people in their 20s, followed by those in their 30s and 40s. They're lowest for seniors. Next slide. Case rates by race and ethnicity, the highest for Black or African American and Hispanic Marylanders most recently. Next slide. This shows both the positivity rate, which is in blue, and the hospitalizations, which is in orange. I believe the hospitalizations as of today or yesterday were over 3,100. Next slide. These are vaccine doses. I don't believe this includes boosters. You can see in this case, that little dashed line is when the 5 to 11-year-olds became eligible, and you saw a little bit of a bump there, and then a second bump, which I'm guessing is when they came back to get their second dose of the Pfizer vaccine. But that vaccination rate has recently retreated to sort of the level it was at through the early fall before those kids could get vaccinated. And if I recall correctly, I believe those kids have been vaccinated. About a third of kids in that age group have been vaccinated so far. Next slide. Vaccination rates by zip code. This map looks very similar to maps that we've seen in previous meetings. I don't know if I have much more else to say about it. Next slide. Maryland is 13th out of all the states in first or single dose vaccinations, and 8th of all the states in full vaccinations, whether that's a single dose or a second dose of Pfizer or Moderna. Next slide. These are recent first dose vaccinations by race and ethnicity. You can see the bump there when the 5 to 11-year-olds became eligible. That bump was highest for Asian Marylanders. It was lowest for Black or African American Marylanders. Most recently, you can see in December, the new vaccination rate, this is for all people, but presumably impacted by the young kids, is lowest for white Marylanders. Next slide. Same thing, but by county. Again, you can see when the 5 to 11-year-olds became eligible, everyone saw an increase, but mostly in Montgomery and Howard County. Recently, the new first dose vaccination rates for all the 8 largest counties in the state is back down to sort of where it was earlier in the fall. Next slide. This is my last one. We've looked at this before. The upper right quadrant is counties that have high cumulative vaccination rates and also high recent vaccination rates. And by contrast, the lower left is those who are low cumulatively and also low recently. And then the other quadrants show counties that are below average cumulatively, but above average daily, or the opposite of that. That's all I have. I'm available for questions. Thank you for your time.
Thank you very much, Mr. Powell. I guess my general takeaway is Omicron is everywhere across the board. It is burning hot. Although it does seem to be less lethal, particularly those for whom are vaccinated and boosted. So before we jump into any questions, let's go to the Secretary. Secretary Schrader, I believe you have a presentation. Do we have that, or do you have that?
Yeah, I think we have just one slide. There we go. So President Ferguson, thank you. And thank you for rescheduling today's meeting to accommodate our weather operations on Monday. I'm sure everybody was affected by that in one way or the other. And good afternoon and Happy New Year, Senators. As always, I appreciate the opportunity to provide an update on our COVID-19 response and recovery. I wanted to begin by speaking about unvaccinated eligible Marylanders who have not gotten a single dose of COVID vaccine. As of today, there are 800,000 eligible Marylanders 365,000 of them are adults, and 434,000 of them are children, are still unvaccinated. And the reason this is important, in December, of the 5,494 Marylanders infected with COVID who were admitted to the hospital, 62% were unvaccinated. Similarly, 63% of Maryland's COVID deaths in December were unvaccinated individuals. The unvaccinated have really pushed our hospital systems and our healthcare heroes to the brink. And unfortunately, we have all the tools, resources, and strategies in place to protect ourselves and every Marylander, but we need to ask every one of them to use them, to exercise common sense, and to take precautions to stay out of the hospital. Adults who are unvaccinated need to get vaccinated, and parents and guardians of unvaccinated children 5 and older need to get their children vaccinated. As we have learned, getting vaccinated and getting a booster remain the strongest possible defense against the virus and severe illness, hospitalization, and death. And Marylanders who have at least one vaccine dose and a booster shot have protected themselves, and equally important, are not getting severely ill, hospitalized, or dying for COVID if they happen to have a post-vaccination infection. As we've been projecting, our statewide COVID-19 hospitalizations have reached record levels. Today, Maryland hit a record high of 3,118 hospitalizations, which is an increase of more than 500% in the last 7 weeks. As Governor Hogan said yesterday, the next 4 to 6 weeks will be the most challenging of the pandemic. Our newest projections show that COVID hospitalizations could reach more than 5,000, which is more than 250% higher than the previous peak. The best way to prove the modeling wrong is for people to get vaccinated, get boosted, and get tested. I strongly encourage every Marylander to wear face covering where prudent and to practice social distancing. Well before we reached these new COVID-19 hospitalization levels, we took a number of proactive measures to prepare for and help mitigate this surge. Because we are now in unprecedented times, the governor took additional action yesterday. To further combat this winter surge, yesterday the governor declared a 30-day state of emergency and catastrophic health emergency. And his new executive orders give the health department the authority to, among other matters, help alleviate the healthcare staffing workforce shortage, regulate hospital personnel, augment the EMS workforce, and to assist and expedite the transfer of patients between facilities as necessary. We've been working closely with the Maryland Hospital Association, the MIMS, and representatives from the nursing home industry on many of these matters, and we've been having regular calls with them for well over a month. A number of hospitals have declared a crisis and have moved to crisis standards of care. Also, at the governor's direction yesterday, 1,000 members of the Maryland National Guard are being mobilized to assist hospitals and nursing homes with COVID-19 response, including testing and non-medical support. Maryland continues to conduct record amounts of testing, with more than 522,000 tests reported between December 23rd and December 31st alone. I am grateful for every Marylander who is getting tested, including those who have patiently waited in line at our 5 state-supported testing sites, those who are using the more than 300 other testing sites across the state, and those who are testing at home. We continue to supply our local health departments with the at-home COVID-19 tests that we secured from Abbott. We thank our partners at Abbott and other test kit vendors for working with Maryland. Local health departments are offering these free tests to the public at locations throughout each of their jurisdictions. And at the governor's direction, we are using all means to acquire additional COVID-19 tests. We have also expanded the hours of operation at our Annapolis and Prince George's County testing sites, both of which are now open 6 days a week, and at the State Center in Baltimore City. And in addition, last Friday, we opened 2 new testing sites, one at the University of Maryland Medical System, Upper Chesapeake Health, and one at Anne Arundel Medical Center. Both are open 7 days a week. And we are currently working to open additional test sites across the state over the next couple of weeks. I also want to continue to encourage Marylanders who test positive to immediately ask their physician about monoclonal antibodies and to go to one of the facilities across Maryland that are administering the treatment if prescribed. Simultaneously, we continue to strongly encourage physicians to discuss and offer monoclonal antibody treatment to people who are infected with COVID-19. There is a national supply shortage of these therapies at the moment, and we have notified providers that we are adjusting our distribution algorithm to ensure that the facilities serving the highest risk patients have the monoclonal antibody to administer, including residents in congregate care facilities. Governor Hogan has called on the Biden administration to get more of these life-saving treatments to the state. And on a positive note, we announced our work with congregate care facilities, local health clinics, physicians, and pharmacies statewide to distribute the 2 newly authorized oral antiviral medicines, Paxlovid and Molnupiravir. Our initial allocation for the federal government is approximately 4,500 courses over the next 2 weeks. As you know, MDH contracted with 3 mobile vaccination vendors last summer. Shortly after they started in July, we discovered some operational issues with one of them, TrueCare 24. When we learned about the issues, we began working with them to ensure they followed all federal vaccine requirements. We gave them a cure notice to cure their defects, but unfortunately, they were unable to properly address the issues. We became aware of inappropriate storage of COVID-19 vaccines on September 2nd and opened an investigation. We stopped giving TrueCare vaccine clinic assignments on September 8th, very soon after that, and we referred this matter to our audit team on September 24th. We take this issue very seriously, and the effectiveness of vaccines and patient safety are of the utmost importance. We reached out to the manufacturers on October 1st, and we contacted the CDC for guidance on November 10th. They advised us to notify the affected individuals. On December 30th, we began contacting the individuals who may have been impacted by this and expect to reach all of them by the end of this week. To be sure, I am not happy about how long it's taken to obtain the clinical next steps. I've directed the audit team to complete their review and have it on my desk no later than the end of this month. Lastly, I want to briefly update you on the MDH network security incident. We sent a more detailed written update on Friday to many of your offices. On December 4th, we detected unauthorized activity involving multiple network infrastructure systems. The state's chief information security officer activated the state's cybersecurity incident response plan through the Maryland Security Operations Center. The state chief information security officer also notified the Maryland Department of Emergency Management to facilitate the interagency response effort. The focus on the response remains protecting the MDH network, conducting a forensic investigation, and restoring core services. The investigation into this incident is ongoing, and to date, we have found no evidence at this point that data was accessed or acquired. MDH is methodically and deliberately restoring network systems and prioritizing health and human safety functions. This approach is helping to protect the integrity of the department's systems and the data they maintain. We are actively engaged with federal law enforcement partners as part of the ongoing criminal investigation as well. Working nearly around the clock since the incident, we have restored several core services. With respect to COVID-19, we resumed reporting vaccination and hospitalization data on December 7th and December 8th, respectively. We resumed top-line data reporting, including the number of statewide rolling average testing positivity rate on our main COVID surveillance dashboard on December 20th. And we resumed reporting for confirmed and probable deaths and death information by jurisdiction on December 28th. Again, this is an ongoing investigation and we will update you regularly. I'll conclude with a thank you and a call to action. Thank you to every Marylander who is vaccinated and has received a booster shot. We all owe each of them a debt of gratitude. They are all well protected from COVID-19, are maintaining their immunity, and are stopping the spread of this disease. Please get boosted as soon as you're eligible. My call of action is to every eligible yet unvaccinated adult and child: get vaccinated now, please. Thank you for the opportunity to update you, Senators. I'm happy to take questions.
Thank you so much, Mr. Secretary. Thank you for that detailed report. It's been a long 8 weeks of, on many, many fronts. I think I want to make sure that these numbers are still correct from what I heard from the hospital systems, from your understanding that the hospitalizations that we are seeing across the state at 3,200 or roughly right now, is it still the case that 70% of those who have been hospitalized are unvaccinated, and almost entirely the remainder are those who may have been partially vaccinated but maybe had the waning vaccination immunity?
Yes, but that number's dropped a little bit. It's down to 62%, but it's still overwhelmingly unvaccinated. And some of us think that the way this is spreading is, we've got our children who are unvaccinated, it's seeing the adults, spreading it to the adults, and that the unvaccinated children create a reservoir for transmission. But the good news is through our Medicaid initiative, the number of adults that are unvaccinated is dropping dramatically. We're at 366,000 who are 18 and over as of today. So that's been a remarkable drop. I want to thank the NAACP. They've been working with us in many of these areas. The managed care organizations have been driving this. So really, we've got to continue with the adults, and that's been a steady drop, but we got to focus on the children.
That makes total sense. I think that the challenge that I think a lot of, at least my constituents who have reached out, I think over the last 18 months, obviously it is very different today than it was 2 years ago. Folks had gotten so focused on the positivity rate as this metric. And I think there is this great deal of confusion around the positivity rate. And in the more mild cases that it seems to be occurring across, there is this dissonance of, well, we have a 26% positivity rate and we're still, we are open. My perspective has been that we're going to have to, for a very long time, learn to live with this. And that's why vaccinations become ever more important. The state of emergency that was put in place yesterday for the 30 days, my sense is that the metric that mattered there was the hospitalizations. Is that an accurate take?
Mr. President, that is absolutely correct. We had our orders and we were able to do quite a bit with the orders and the authority that we had in the Health General article. However, we have now moved into a multi-agency response, which requires resources like the Guard and other authorities. So we are going to be using that. And we also want to protect healthcare staff. The healthcare staff have been working tirelessly now for 2 years. This is an exhausting experience.
Yeah, exhausted.
We did an analysis, Mr. President, of the licensed professionals in the state, and we called many of them, and we found that of the 40,000 or so who still had not renewed their license, many of them almost 40 or 50% said they were leaving the field or not going back to work. Or retiring. It was remarkable. So this has just worn people out, quite frankly.
And I guess that my sort of theory of action, it's impossible to prove a negative, but in the case, and to no fault of any particular entity or individual, if in a world where Maryland, that 800,000 that was left, if they had been fully vaccinated, had been fully boosted, there certainly would have been some level of hospitalizations, but not to the degree to which we're seeing now. And if our hospitalization rate is the thing that is causing this new level of, if we are going to learn to live with it, it has to be at a place where people are not crowding the hospitals. And that is only going to happen, it appears, through ongoing vaccination processes. Is that?
I couldn't agree with you more. Absolutely. And we have taken the approach, and it's worked, that we want to persuade people, not force them. And that persuasion has been working. The difference in where we are right now is the transmissibility, or the transmission rate of
This variant
is 3 or 4 times
significantly higher.
Yeah, it's higher, exactly. And you can't anticipate that. There will be more variants. This is not the last variant we're going to see.
Yeah, no, I think Senator Roosevelt we spent a long time talking about sort of the testing and ongoing testing plans. If we are going to learn to live with this and not have to shut down society every time, those are the things that are going to probably become more commonplace. But I want to make sure that we have to be very mindful of time. So each senator is going to have 5 minutes. We're going to go with Senator Lamb, then Senator Eckert, Young, Roosevelt, Washington. So I'm going to hand it over to Senator Lamb. You have 5 minutes, Senator. Senator, we can't hear you. You are off mute, but your microphone may be.
Hear me now?
There we go. You're all set.
Sorry about that. So I am concerned about the continuing spread of cases. And I know that yesterday there was a masking mandate that was put back in place for state-owned and operated buildings. But we also note that the spread of the virus is not limited to these buildings, and a full statewide mask mandate, I think, would be far more effective to help us weather the current wave that we're in. Last week, Mr. Secretary, you were quoted in the Washington Post that a reinstatement of the mask mandate is not on the table. Obviously, there were some changes that were put into place yesterday, but they were very limited. And so I'm concerned about and would really seek to have a full statewide mask mandate put in. So my question to you, Mr. Secretary, is how many more Marylanders must become hospitalized or die before we'll reinstate a full mask mandate here in the state?
So, Senator, I think you also, if you read the whole article, I said, and I don't know if they put this in there, but when we talked with them, that we are attempting to create a culture of education. And we want to persuade people, not force them. And by persuading them, it'll change the culture. Now, culture change takes a while. There are cultures in this world where wearing masks is second nature. It hasn't been second nature in our country, but many more people are adopting that practice. And by persuading people and being patient, I think we will change the culture over time.
Mr. Secretary, with all due respect, I think, we're in the middle of a pandemic. Our hospitals are being flooded out right now. And I don't think we have the time to wait on changing culture. And at some point there may be a need, and I think the time is now to really look at putting in place a requirement for this to be able to happen. It's similar to, getting people to wear seatbelts. Ideally, people would do the right thing to save their own lives, but sometimes they're not. And sometimes you need to put a requirement or a mandate in to make people do the right things and to also safeguard other drivers and the broader community. And I think this is one of those times. The other thing I want to touch on is this whistleblower situation with TrueCare. And I did have a chance to speak to the whistleblower earlier. And my concern is that this is not just a problem with TrueCare, that there may be more systemic problems in place here with other vendors that are administering the vaccine as well. That TrueCare may only be the tip of the iceberg that the public has heard about and that the press has caught on to. But there are other vendors like Spartan and Ambulance and Vetis that may also have quality control issues in handling the vaccine. I think the systemic problem lies from the fact that a lot of these vendors were being asked to be paid per shot for each shot administered. And so it seems like at the department, there's a blind drive towards just hitting numbers to get as many people vaccinated as possible, regardless of the cost and regardless of the risk of safety. And so what can you say about how the other vendors, in addition to TrueCare, and how are they being monitored and audited for proper compliance to safety and handling procedures?
Senator, I'm glad you raised that point. I didn't have time to get into that detail, but this is the way the situation went. Back in the spring, we brought on 3 or 4 contractors in the per shot model to test it. And you're right, we found out that we weren't satisfied with that approach. Over the summer, we rebid that contract and brought on 4 new contractors that started in the August timeframe, and they were being paid by session. So it didn't matter how many shots they gave. We paid them a flat rate, and there was no incentive to cut corners, and they had every incentive to do the session. That has worked much, much better. We have a physician's assistant who oversees the operations. We have about 13 people who are in the clinical quality area. So you're 100% correct. When we piloted this last spring, we recognized very quickly that that model was going to work. And within 90 days, we had converted the whole model, and it's working much better through the fall.
My concern with the clinical quality teams is that they've been told to stay hands off on these outside vendors, that everyone is really just trying to press the numbers and just to, quote, make it work, regardless of the quality or the safety issues that have come up. And when this whistleblower brought it up to the Office Inspector General within the department, they were told that it was simply outside of the jurisdiction of that office. So I think there's systemic problems there as well. So I am concerned that your gut reaction, Mr. Secretary, to these MDH employees who are trying to do the right thing based on science and protocol is to demote and fire them, which I think is unacceptable. It's demoralizing to staff there, especially when they're just trying to follow the department's policy and protect the safety of Marylanders, whether it's this whistleblower or the health officer over in Harford County. When it comes to ensuring the proper safety and handling of these types of vaccines and of tests, it's incredibly important, whether it's the clunky South Korean tests, the PPEs that were ordered from politically connected companies with no prior history to deliver, or the firing of health officers trying to protect their counties, or even the demotion of an internal whistleblower. Your decisions as the secretary seem to follow a pattern of behavior that's consistently deflects blame but fires the messenger. So I'd like to hear what your response is to that.
Right.
Well,
very briefly, we're gonna have to move along.
No, I'm glad you brought this up because you raised some very important questions, and I'll try not to go on too long. But your sequencing was a little out of sort there. The fact of the matter is that this was brought to the attention of the IG, and we have an audit compliance group that handles operational issues. It was brought to that individual, and as subsequent to that, we stopped awarding business to TrueCare immediately after it was disclosed to our audit group. So your information is partially correct, but there's a lot more to the story. We can talk about it offline. I absolutely agree with you that our clinical audit team is empowered to drive quality, and we have a lot of very hardworking people that are doing the right thing every day to make sure we're providing these services. So I appreciate you bringing it up because there is a story to be told here.
All right. Thank you, Mr. Secretary. Thank you, Senator. We're going to have to move along to Senator Eckert.
Thank you very much. Thank you, Mr. Secretary, for that update. I've gotten a lot of questions on a number of those issues that you're offered. I just want to say many of the constituents who call in to me are grateful for not across the board mandate. We have a lot of varying opinions and thoughts and beliefs about this whole virus and its impact, the effectiveness of the vaccine. So thank you for that. But I do want to ask, do you know if there's any research being done on natural immunity? I'm hearing from many who believe that the natural immunity, getting the illness, having a reaction to it, is as effective as getting the vaccine. I'm just asking quickly if you know of any studies on that, because I have one other important question.
Yeah, I'm not sure, but we'll look into it. We've been, the gold standard has been the vaccinations.
Right.
And as we bring that number down of unvaccinated, that's where our work has been. I'm not aware of the federal government conducting those kind of studies, but we'll look into it.
Thank you very much. And the other issue I've been asked about repeatedly, we have a lot of folks who are moving in and out of our counties who do not have access to resources. And occasionally I will get a call late on a weekend. We need a lot of additional test kits because of folks who are showing up sick. Are there any other resources I can direct folks to other than our federally qualified health centers, our pharmacies, and our health departments, our colleges and universities, and hospitals? If the need arises that there is a number of people who need to be tested and not wait.
Yeah, and I assume, Senator, you're talking about point of care tests versus PCR tests?
Any of them.
Yeah. So I won't deny that our supply is stressed given the demand. And we do have a website, covidtest.maryland.gov, that people can go to. But the reality is, over the summer, if you recall, there was this perception that we were out of the woods. And during that process, we actually went in the other direction as a state, which is helping us now. We bought 1 million tests, point of care tests from Abbott, so that we had them stored and ready to go. And we also bought the other Abbott tests so that we could run our operations at our other testing sites around the state. In addition to that, we made it a point to put together a very robust testing regimen for schools, because we realized in the summer that as soon as school started, there was going to be a spread. It's just a natural thing to occur with so many unvaccinated children. And we've invested, we received $160 million from the federal government, and we put in place contracts so that school systems can order off those contracts, which they are using, and a limited amount of money for reimbursement if a jurisdiction wanted to do it themselves. So we are in a strained place. We're looking to order a lot more tests, because I think the Senate President said it earlier, testing is going to be a major strategy going forward, even after this surge. But we did not rest on our laurels last summer. We continued to buy tests and stockpile tests because we think it's an important tool.
Thank you. I still need to know who to call. If you could let me know that.
We'll get back to you.
In case we've exhausted all the local one case in point, we were able to get another 4,000 tests, but they were only usable by a certain date, and they were helpful, but when they're out of date, they're not helpful.
Right.
They were time limited. Just need to know, because we're seeing an influx of folks in our communities.
We'll follow up with you directly
Thank you.
offline, Senator.
Great, thank you.
You're welcome.
Thank you, Senator.
Thank
All
you,
right, next up, we have Senator Young. So you have 5 minutes.
Okay, thank you very much, Mr. President, and thank you, Mr. Secretary. I'm going to say everything I have to say and then let you finish off my time talking.
Yes, sir.
I know I'm happy that the governor has at least said he'd call out the National Guard. It's part of the request that I had from our county exec. I know Delegate Lewis Young called your office today, and I think that our county exec, Jan Gardner, has written you. She was requesting that if she could get 20 clinicians and 20 non-clinicians and 4 security people to help at the hospital, that they could handle a huge portion of the testing there. She has also requested a state testing site, and the hospital has the facilities there to process the specimens. So with that kind of help, we could handle much of what's going on here. So hopefully you can consider that. Then the other 3 quick things. I think you said 62% of the people, or I forget whether it was 62 or 64, that died were non-vaccinated. Of the ones that were vaccinated, do you have a breakdown as to whether they had 1 shot, 2 shots, or 2 and a booster? But because supposedly if you've had 2 and a booster, you're not going to die. It's just going to be a mild case. So I'd like to know of those that have died, that have had shots, what did they have? And secondly, what percentage of in the early report we heard about percentages of people had 1 shot and 2 shots. What's the percentage of people in Maryland that have had both shots and a booster? And then finally, thing I hear most from my citizens here is that those that feel like they've had shots are being penalized and are being held hostage by those that haven't. And it's like we have to keep going through all these things because they've done the right thing, but the penalties that come down seem to come down on them, not on those that haven't had the shots. So while masks are important, and I think they're an addition, there's a lot saying now they don't stop this latest virus from getting through to you. Is there any way that states ever going to consider mandates? Now, we can't mandate somebody to get a shot, but we can do what I saw in New York when I was there. You can't go into a lot of public places if you haven't had the 2 shots and the booster. So we're not telling you you have to get a shot, but we're telling you there are a lot of places you can't go if you haven't. And that, I think, would be a big encouragement for more people to get shots. But there is a perception among a lot of people that we're rewarding those that aren't doing the right thing and punishing those that are. So is there a reason that we won't consider a passport to go into a lot of public places? That concludes my questions.
Okay. I want to be respectful of making sure you finished. Well, let me start at the top. So we are, as we speak, assessing the National Guard resources. I'm aware of the request from Frederick, and I know we want to set up testing, and we want to put the tests near the hospitals, because part of the problems the hospitals are having is a flow-through problem. And so on the front end, by putting the testing site near the emergency department, it diverts people away from the emergency department and gets them tested. So we're definitely looking at that. And we are looking at the Guard resources for mostly non-clinical and some security missions possibly. The clinical missions we're shying away from for the Guard, because what we don't want to do is take a guardsman who's a clinician and practicing in a place, pulling them out and then redeploying them somewhere else, because that's a net zero game. So where we're focused is the non-clinical and possibly security missions. For your second question about those that are not boosted, As I was looking at the death data over the months of November and December, those who were not boosted were the next category of people who were dying and being hospitalized. So and I've talked to, anecdotally to a lot of people who've got this Omicron virus, and they've been able to remain at home, but they had 2 shots and a booster. Again, people who are not boosted, and right now we have about 1.6 million people boosted. That's about half of where I think we need to get to in the next couple of months. So we've got to have a focus on boosters. But your assumption there, I believe, is correct, that if you're not boosted, you're at more risk. In terms of the stats, we right now for people 12 and older, we have about 5.1 million Marylanders, and 88.6% have 1 shot at least. And we were tracking for a long time the adult population 18 and over. There we're at 92.2%. So that's going very well. For the children 5 to 11, we're at 34%. So we need to really bump those numbers up. And for the children 12 to 17, it's actually encouraging. We're at 78%, but we need to do better. So the numbers are growing, as I said. And then to your last question, which I think you framed as a moral hazard, is I'll say 2 things. One is I want to go back to what I said earlier. We want to persuade, not force, because this disease, we got to learn to live with it. It's going to be here, and if we can persuade people to do the right thing, and more of them are doing the right thing, I think it'll serve us well for the long haul. And then the other thing is, for those that are unvaccinated, they're not, as a group, they're not getting away with it. There are the people who are dying and being hospitalized are suffering those consequences, and you're basically playing with your life by being unvaccinated. So, it all depends on how you view it, but that's the way I've been looking at it.
Thank you, Mr. Secretary. We have to move along. Senator Rosebeth, you have 5 minutes.
Thank you very, very much. 2 separate things I want to raise. First of all, I think your numbers suggest that the majority of unvaccinated are the folks under 18, right?
That is correct.
Right. I'm stunned at why it's been so hard to get the little kids vaccinated. Is it resistance among the parents who are already vaccinated? Is it the kids are resisting what their parents want to do? Is it that it's not being done in the schools and therefore the access is not there? How could it possibly be that we're at a 32% vaccination rate for the little kids?
I've been asking a lot of people that question, and I don't have a good answer for you yet. We're going to continue to drive this. I don't know. I wish I did, and we're studying this to try and figure it out. One thought is that many of the adults who are not vaccinated in the 18 to 39 zone are the same people who are not having their children vaccinated, but that doesn't explain all of it, to be honest with you.
Yeah, I think we need a real aggressive strategy. And the most straightforward one is for the school systems who have the authority, according to the Attorney General, to put in their own vaccine mandates for COVID, the way we've had vaccine mandates for all kinds of other vaccines since I was a kid. So if the health department would do it, I'd love you to do it. But if you're not going to do it, I hope the local school systems, because they're the ones who are responsible for the kids. Something's got to change here. So let's move on to the second question. I applaud what you did to get tests in the summer, and the governor's announcement of getting 500 tests at the beginning of December. But those really were a drop in the bucket, as was demonstrated by my constituents who were sitting in line for 7.5 hours over the holidays to get a test. Not only is that dangerous in terms of people not being asked to test when they need them, it also is terribly destructive of confidence in the government's ability to serve the people. I mean, this is not the spring of 2020. This is this was December of 2021. And as you know, last year, the legislature passed a bill on testing and vaccinations that laid out a plan to say we need to get to where we need for the medium term and the longer term, not just shorter term. So we don't get in the situation that we were over the holidays. It passed unanimously in the Senate. It passed by a 4-1 margin in the House, and the governor vetoed it. Now, we overrode the veto during the special session. But I'd like to ask you, Mr. Secretary, is the administration willing to work with us during this session to pass a bill that the governor won't veto to plan medium term and long term for making sure we have the tests we need, make sure we have the vaccines we need, and now with the pills coming, making sure that we have the pills we need?
So as you know, we're heading into the legislative session. We'll be tracking all the bills closely, and I would say let's see where it lands. But we're obviously interested in what you're thinking and where you plan to take us.
Well, we'd appreciate the support of the governor and the administration on working with us, and particularly because this is the last year of the governor's administration. The virus is going to outlast the governor's term of office. And so that's why I think we need to work together on planning that takes us a couple of years out so we don't end up with 7.5-hour waits for tests over Christmas of 2022. Thank you very much, Mr. President.
Thank you, Senator. All right, Senator Washington, 5 minutes.
Thank you. Are you able to hear me okay? Good, I have a new mic. Thank you, Secretary Schrader. I would like to actually build up on Senator Lamb's, and I appreciate you addressing TrueCare in your opening remarks. But so essentially what I'm hearing, so long and short, is that we knew there was a vendor who was not operating within specs. Some may even say to a criminal degree with the vaccines. They were allowed to operate to move towards a corrective action. They did not operate correct. They did not correct the problem. But my concern here is that this vendor was operating in some of our most marginalized communities, and I'm very concerned when we talk about, again, trust, and the good senator from Prince George's County also mentioned that about having trust in state government, trust in the administration to handle these problems through the pandemic. So I'm very concerned about the spoiled vaccines and that they were administered primarily to exactly the communities who are most need and have been most apprehensive and cynical about the vaccine. So right now, and just correct me if I'm wrong, we have a situation where we might not know, or do people know if they are vaccinated or they're not vaccinated? And are they then potentially vectors of transmission, placing all of us at risk, particularly during this time of soaring rates? And so while it's important to say that, they're no longer operating, but I think to Senator Lamb's point, really understanding how it happened, what happened. But for me, the priority right now is mitigating the damage done to the safety and health of our communities. So I have a couple of questions, and that I think there's 3 of them, and I'll get them all out, and you can begin to answer it, but I believe this is something we'll continue into the weeks to come. So one, how are we urgently prioritizing getting in touch with people who are potentially affected? So I guess there was about 1,000 people who believe that they were vaccinated and they might not believe. And according to the Sun, about 28% of them are in congregate settings. So, which again, amplifies exponentially the potential in our correctional facilities and some other of our group homes for transmission. So the first question is, what specific steps are being taken to identify, notify, and properly counsel those who may have been affected, how they can protect themselves, particularly those who are incarcerated? Are you able to move quickly on this and get this done within the next 5 to 10 days? So that's my first question. Second, we need to make sure that these people can be revaccinated in the quickest way possible, assuming that is safe, as well as offering frequent and free testing So are you doing that in this specific population that is in congregate housing, is in our correctional facilities, where historically the state thus far has not done as good a job as we could have, admittedly. And then third, we need to develop, or you need to develop, a clear communication plan to ensure that whatever happened doesn't delegitimize the vaccine, right? We have to ensure that people understand exactly what happened and that this does not mean that they were poisoned or infected with something harmful. That's what we're hearing. And so I want to know what that is happening. And also, finally, I guess the DOC has just begun providing boosters. And that's sort of been happening. I'm hearing that that's uneven. So it's about the boosters, it's about the messaging, about making very clear that you know what happened and that we cannot lose further trust in the vaccine. Secondly, that our individuals who received an incorrect vaccine getting revaccinated. And then that first question of really focusing on this congregate settings on our prisons and making sure that we are focusing on those populations in the next 5 days.
So let me start by saying, I just wanted to make one clarification. These were not spoiled vaccinations. The reason this was out of abundance of caution when we found out that they were not documenting properly and using the proper temperature approach, that we took action. And that right now we have, and again, I said earlier, I'm really not happy that this has taken so long because it should have been done a lot quicker. We found out about it in September. We stopped the contractor, and then we took 3 months to figure out what to do. That was not acceptable. Of the 926 individuals involved, we have already sent by email 518 of them. For those that don't have emails, we are mailing letters, and those will all go out this week. As part of that process, they will be offered another appointment. It's very likely that the vaccine that they received is effective, but we don't want to take a chance that it wasn't, and we ought to offer them another vaccination. And we will, we're communicating with them directly. On the prisons, we've been working very closely with Secretary Green. He's been very vigilant and really, based on my understanding and speaking with him, his national numbers and our partnership of vaccination and testing, he runs one of the best prison systems in the country, and we continue to support him in that regard. So we will continue to focus on this, but I did want to clarify, and you're probably right, we should make it clear in our communications that these were not spoiled vaccinations.
Right, and just to wrap, and just to press again, we've been going through this. We've all been meeting for almost a year, this group, and you say that you are not happy with the fact that it took so long, but at the end of the day, that's on you, right? And so we really need, right? So we need you to move.
What stops with me, man.
Right, and so we're having this pattern. I guess what we want to do is that we're having this pattern of something happening that is being, by someone swept under the rug or not dealt with, in a straightforward manner. Then the press or we have to uncover it, and then that wastes a lot of time. And frankly, it's costing lives. So I'm looking forward to us, not repeating what we've repeated the last 18 months. And can we just get some transparency, make sure that people who have the skills to do this work are doing this work, and that your messaging is very clear about separating, being just very clear about what's happening. Otherwise, other narratives develop. So thank you, Mr. Secretary. I look forward to the other answers, but we're not satisfied with this either.
Thank you, Senator.
All right. one last question before we go. Just the question that I've been getting every day is just where should we be pointing people for tests right now in the short term over these next 5 weeks when things are going to be acute? What is an individual Marylander's best chance? What steps should they take to get tested if they need it?
Yeah, so there's two places. We've got a lot of information on covidtest.maryland.gov to get access and know where to go. The other place is to call the local health department. They've been very responsive and we're giving them tests also. So I'd say those are the two best venues.
Great. All right. Well, look, we are in the midst of it. Sadly, I think if we didn't have the hospitalizations, we'd be living through it in a much more predictable way. That's the thing that just keeps coming back. And, we know that the hospitalization is tied to the vaccination rate. And it's just, it is very frustrating to be facing it over and over and again when we see the strategy at the end or the light at the end of the tunnel. Just have to get there. But appreciate the candor and the open feedback today, Mr. Secretary. Thank you very much. Thank you, senators, for being here and your ongoing participation, serving your communities. We're going to get through this like we have the other waves. We'll get to the other side, but in the meantime, we'll see you all next week at the 2022 session. Take care, everyone. Stay safe.
Stay safe, right.